came into existence in 2003 and became full functional in 2006. The founder of the Ladakh Animal Care Society is Mr. Tsewang Morup Sabu. He provided land for construction of clinics and shelter for dogs and organized everything which is needed for sterilization and vaccination of dogs to control the dog population and rabies. It is important to mention the names of few people. Mr. Dr. Abdul Qayyum, presently he is Chief Animal Husbandry Officer Leh. At that time in 2006, he was acting as Disease Investigation Officer at Leh, given full support to this Ladakh Animal Care Society to become full functional. Besides this, Department of Animal Husbandry Leh and Municipal Community Leh extended full support for this organization. Since 2006, with the support of Animal Welfare Board of India, Municipal Committee Leh, and Animal Husbandry Leh, and BBB, Vets Beyond Border Australia, World Job for Animal Foundation members Ingrid Smulder started ABC program at Sabu and till date did 7,000 dog of sterilization with anti-rabies vaccines. And with this, throughout the year, sterilization goes on, which is very important for the success of ABC program. The importance of ABC program. ABC program means animal birth control. Control of dog population and vaccination is very important because 55,000 people die due to rabies in all over the world, and 20,000 people lost in India per annum due to rabies. This data is according to the World Health Organization in 2009. What is rabies? It is very important to know. Rabies is a RNA viral disease which is caused by Lysa virus. This virus is found in the saliva of dog. So, when a dog bites anybody or animal such as goat, sheep, cattle, horse, and pig, it contaminates us or animal, and if not treated properly, then this causes death to the animal or loss of the animal. Rabies is an acute viral infection in man and other warm-blooded animals, characterized by sign of abnormal misbehavior, nervousness disturbances such as increased excitability and irritability, impairment of consciousness, ascending paralysis, and death. The disease is propagated by bite from animal to man and man to animal. When the disease occurs in the man, symptom is manifested fear of water, hydrophobia. It may be between the incubation period is between 11 to 27 days. The virus is found in saliva of dog 3 to 8 days prior to manifestation of clinical symptoms. There is no specific treatment for clinical rabies, but 100% preventable by vaccination. Under British rule, there have been organized efforts to reduce the dog population in towns and cities because main aim of this was to control the spread of rabies by controlling the number of dogs. To this end, the municipalities in India used to catch and kill dogs in public places using various of barbaric methods like shooting, drowning, poisoning, or by electrocution. Official records shows that in successfully succeeding year, more and more dogs being killed, yet the number of deaths keep growing and catch and kill method for control of dog population is and rabies were found. In 1964, Blue Cross proposed that measures to this issue and done mass spay and vaccination and return program. This would ensure that there were no new birth from the operated animals and that since the spread of rabies would be controlled. The program that was named as Animal Birth Control, which is as simple as ABC. Within 1 year of replacing the brutal catch and kill program with a spay, vaccinate and return alternative, the number of human deaths from rabies began to drop. By the year 2000, results were so encouraging that the government of India adopted ABC as official program of government, and India became the first no-kill country in the world. The result of World Health Organization sponsored study of rabies in India covering 10 years period from 1993 to 2002 were published in 2004. Its major finding were the number of deaths due to rabies in India were 17,500 per year. Yet, wherever ABC was being implemented, the incidence of rabies showed a drop. Canine rabies control is also often only associated with voluntary welfare organizations or groups, even though it is a matter of public health and should be therefore receive high priority in public veterinary services and also in human health sector, being the most cost-effective ways to reduce human rabies cases. Options for prevention of human rabies. Rabies causes horrible death, and once the symptoms start, there is no cure. However, there are 3 ways to prevent rabies in human. By preventing the transmission of rabies virus within the host species, by treating all the people that have been bitten by dogs unknown vaccination status, and by vaccinating people with pre-exposure rabies vaccine. And beside this, public education is a crucial component of both the approaches. Treatment of post-exposure vaccination. According to some estimate, approximately 5 lakh people in India receive every year post-exposure vaccination treatment that consists of 5 vaccine doses and costs 1,500 rupees. And according to M.K. Sudarshan survey in 2007, the full cost of post-exposure treatment of human that have been bitten in India is $25 million. Is that approximately 1,500 crores? The estimated state of population in India is 8 million to 20 million, which is to be reduced by bringing animal birth control program. In Mexico, human rabies cases declined to 0 within 10 years since mass vaccination of dogs started. In India, Jaipur and Chennai is an example of a city where rabies control through mass vaccination and neutering of dogs has resulted in eradication of the human rabies. In Leh, as per record of dog bite cases entered in S&M Hospital Leh is 50 to 60 person per month, and data from April to July is 188 dog bite cases are entered. And if we consider 50 cases as an average, then dog bite cases to human is 600 per annum in Leh district. As per the dog census data, dog population within municipal community area, which is census by Animal Husbandry Department, is 2,854 dogs, according to the census of 2013. Therefore, to control the dog population and rabies disease, to make ABC program successful becomes essential. And this is very important for us to aware the people through mass communication or through this media that rabies disease is very dangerous in Leh district, but due to financial consistencies, the program is not too much successful. As we are aware of the fact that to become the ABC program to control the dog population and rabies disease, during the ABC program, it is very, very essential that in a particular area, out of 100%, 70% of the dog population has to be sterilized or neutered and be vaccinated. If it is possible, then the control of dog population and rabies disease from the Leh district should be eradicated. But it is not up to the extent we are doing. Before last year, the ABC program at our society is gone during the summer season only, and from last year when I joined in the society, we did in the winter season also, and during the winter season we did 271 cases of dog sterilization and vaccination of rabies cases. Therefore, now I request the administration and the organizations or other NGOs to support the Ladakh Animal Care Society. I also request the people of the Ladakh should know the causes of the death disease of rabies and come forward to vaccinate their pet dogs and do vaccinate the street dogs. And finally, I once again thank the TEDx to giving us this opportunity, for giving us this opportunity. Thank you very much.